This program is made possible by American Senior Benefits Wichita is all about your peace of mind. We specialize in asset protecting, safeguarding your health, planning your estate, and preserving your freedom of choice. We're here to work through all of this with you. American Senior Benefits Wichita proudly supports PBS Kansas. The Candle Club, a place where friends, food, and music come together. Currently, we offer live entertainment every night except Sundays. Enjoy our delicious specialty appetizers and the Candle Club signature prime rib. More about upcoming events at candleclubwichita.com. Home Health and Hospice of Kansas is a locally owned and community-based provider. We offer quality health care to our patients and families, complete with love, warmth, and compassion. We'll take care of all of the details for you. For more information, please visit kansashomehealth.com. Welcome to Cedric Plaza Retirement Community. Our living options are designed to suit your specific needs and activities that you're sure to love. We believe you'll be able to see yourself here, enjoying time with friends and family. For more information, visit cedricplaza.org.
Welcome to Empowering Seniors. I'm your host, Katherine Ambrose, and today I'm seated with Eric Litwiller with the Mental Health Association. Eric, things have been crazy through 2020 and into 2021, so share with us some of the things that we should probably know about what's going on in the world.
Yeah, the pandemic obviously has really dramatically affected mental health here, not only obviously in the Wichita community, but all throughout South Central Kansas, really all throughout the world, I suppose. And so it's been interesting to see kind of the various phases almost, I want to say. I think, initially people were getting sent home and things were literally changing by the hour. They felt like the sand was shifting underneath their feet. And so people very much kind of entered this hunker down phase where, okay, I got sent home. I'm just going to go home. I'm going to make sure I have a roof over my head and food in the pantry. And we're just going to wait this out for a couple of weeks. Because I don't know about you, but I thought it was only going to be a couple of weeks, like a lot of us did. So there was kind of that early phase. And then kind of during the summer, there was this slow realization on behalf of people that this was not going away anytime real soon.
Our audience, Empowering Seniors, a lot are probably helping with grandchildren or great-grandchildren.
Sure. If they're lucky enough to be near their families, which is not always common these days.
That's true. And then the isolation from families. Yeah. So many seniors concerned about having family come visit them or you're traveling. How do you think that this has really impacted people that are isolated in their homes?
Isolation is always a huge issue from the standpoint of mental health. People were using the phrase social isolation, I think, early on. We're not trying to socially isolate. That is exactly the opposite of what people need to be doing right now. Stay connected via emails, write letters, actually use your phone to make phone calls, heaven forbid. Try to stay connected however you can. And luckily, I think that social isolation phrase went away fairly quickly. But yeah, isolation is really always the enemy of mental health. And there's no question we saw a lot of that. People were trying to figure out how to cope not only with physical health, but try to cope with their isolation, try to cope with, I'm stuck in the house with this person I married and I have not been able to get away for months on end, or with kids, or I'm worried about my job, or any number of other things. And they were using, I think, a lot of tools that we all use to try to cope. The problem is you can overcome a bad day at work by having a couple beers on Friday night, getting a good night's sleep. You wake up on Saturday, things are okay. Under normal circumstances, maybe that works. Still not a great option, but it's workable perhaps. Because of the dramatically more stressful times, people were saying, well, if 2 beers got me through Friday night, then maybe a 6-pack gets me through this week. And then it became more. And we saw with all kinds of addictive behaviors, from alcohol to drugs to food to shopping to online gaming. Addictive behaviors were our coping mechanisms before, and this pandemic just caused them to grow to the nth degree. And so that was a lot of some of the issues that we saw as people started finally to come back and get the therapy they needed.
I heard a phrase coined by a physician. There's more to life than a heartbeat. And that couldn't be more true in today's environment. There is more to life than just a heartbeat. We're struggling in trying to sort out all of this craziness of whether to isolate, whether to quarantine, whether to stay away from people, whether to wear masks, not wear masks. And we're doing it at the cost and the expense of just breakdown.
There is a stigma about mental health, but I think it's getting better. I actually think it's getting better. There's not so much of a stigma, especially because everybody's going through the COVID thing and the isolation. So I think people are reaching out more.
What has been a topic of discussion among your leadership on how to address some of these things?
We know obviously mental health is not going away anytime soon. It wasn't going to before this. But during a time like this, you're talking about health clinics, you're talking about food pantries, and you're talking about mental health. And I'm not telling any donor your church is no longer important, your alma mater is no longer important, but I am saying what makes a dramatic increase right now, and it's those three things.
What kind of programs do you have available for people to plug into?
At any given year, MHA is going to have somewhere between 30 and 35 different programs. And so we kind of try to loosely categorize them by, I don't want to say necessarily age groups, but some of them by different types of needs. So we have an entire division dedicated to senior mental health. And so in that realm, we might have things like looking for signs of elder abuse, scams. Again, isolation was a huge one. In fact, we have a senior companion program that's explicitly for senior isolation.
Now we're going to visit with Leslie Macheka at the Mental Health Association. Leslie, welcome to Empowering Seniors.
Thank you.
So you are in charge of the Senior Companion Program, and what are some of the other things that you do?
Mainly the Senior Companion Program. We really focus on recruiting volunteers that are 55 and older. They go in and help seniors that are isolated or alone. We get a lot of referrals from home health agencies. They're needing help with medication reminders, maybe just coming by to visit with them, do puzzles. Our main goal is to keep them living at home as long as possible and also provide respite for our primary caregivers so they're able to still go to work, go to their medical appointments, and maintain their life as well. It's a great way for them to still connect with their peers, and I believe it also helps them stay active and living longer as well. So it's really a twofold program. It's awesome.
So it sounds like the Senior Companions get some fulfillment out of that too and gives them some purpose.
Absolutely.
And what are some of the things that they do with people that they visit?
Companionship is really what we focus on. A lot of our seniors are lonely at home. So when I go out and meet with the client or the family, we talk about what their interests are. Do you like Western movies? Do you like puzzles? So activities like that help with brain stimulation. They also can help clients get to and from medical appointments or to the grocery store, light meal preparation, reminding them to take their meds, taking them to the pharmacy to get their meds. So really just going in and helping them stay living independently as long as possible and giving the caregiver a peace of mind knowing that someone's there with their loved one.
Tell us a little bit about the reasons why someone might seek to have a companion come visit them.
We get calls from caregivers. They're needing relief. They're at home all the time.
Like a family member?
Absolutely. They're with maybe someone that has dementia. They want to stay living with their family member, but they still need to live their life too. And so our volunteer will go in and sit with their loved ones so they can go do what they need to do. Other phone calls, especially recently since the pandemic, are seniors that are depressed. They're lonely. They want someone to come and see them and visit them. They may have family here in town and nobody comes to see them. Their children, they don't call them. They're extremely lonely and they can't be with their peers. So our volunteers have been calling their clients. We have not been able to go back to doing face-to-face yet, but there are a lot of depressed, lonely seniors. And so I think that really is what their main focus is too, is, to brighten somebody's day and let them know that, we do care and somebody is here for you and we're here to listen. And they just want to talk. They just want somebody to hear them and know, that they're there and they care.
How do you determine eligibility for someone and being able to provide a companion for them?
The criteria really is, are you in need of a volunteer? You don't have anybody. Are you lonely? Would you benefit from a volunteer coming out and seeing you?
Do you have a lot of volunteers available, or do you have a shortage of volunteers?
We're always looking to recruit volunteers. Right now we have 40, and I think we're serving around 97 clients. We do have a wait list. It just really depends on what the client is interested in and if we have a volunteer that's going to be compatible with that client. That's really what we focus on because we want it to be a successful match for the volunteer and the client. I have a volunteer that lost her husband. They had been married for many years, and she was extremely depressed and lonely, and she used to be very active out in her community with her husband, and she came to me and was very interested in what we were doing, and she had some history of working with seniors, and she became a volunteer and has just blossomed. I mean, she looks forward to every single day when she gets to go see her clients now she's making phone calls, but even just the phone calls and getting to know the family and knowing that she makes a difference, she just said it's the reason that she gets up every day because she knows she's making a difference in her senior's life, and they look forward to her just as much. So I think, and even in all the volunteers, that's what it's really about. They're still connecting with peers and it keeps them active, and they know they're making a difference and helping someone.
Thank you, Leslie. Great work you're doing in the community, and that was very informative.
Thank you.
And now let's get back to our conversation with Eric. So if people have concerns about their own levels of anxiety or stress, or one of their family members, perhaps even a grandchild, what steps should they take to reach out?
I hate to say this, but the truth of the matter is really the first step has to be recognition. Mathematically, just in the city of Wichita, and I'm not even talking about the Wichita metro area, I'm talking about the city of Wichita, we know every single year there are 100,000 people in Wichita with a diagnosable mental health concern. What we need is for those people to be willing to raise their hand and say, the heck with the stigma, I need help. Of those 100,000 in a given year, maybe about 40,000 will actually be willing to get that help. But that means in the city alone, there's 60,000 people with a diagnosable mental health concern who are not seeking, who are not receiving treatment. So first and foremost, they have to look for signs either in their friends, their loved ones, or themselves, and be willing to raise their hand and acknowledge, regardless of the stigma, that yes, I need help and I'm willing to make steps to make that happen. That's first and foremost. Beyond that, they have to know resources. And that's tough in the mental health field because if we see someone with a broken arm, we know what to do. We know who to call. We know where to go. The same is not true of mental health. I mean, think about if you're having coffee downtown and you see a guy in January walking down the street in 10-degree weather with his shirt off yelling at the squirrels, you don't really know what to do. Right. A lot of us don't. And so really probably the second step is be aware of the resources. I would venture to guess that if I gave that scenario to 100 people on the street, probably at least 95 of them would say, well, if I saw that guy, I'd call the police. Right. Well, guess what? He's not breaking any laws. He may need help. I don't deny that. He does need help. But he's not breaking any laws. Police are there for law enforcement. We will call the police, generally speaking, and they might come and pick him up, and they try to figure out what to do with him just the same as you were probably trying to figure out what to do with him. So far too many people are aware of the resources available to them. If we can raise the threshold of awareness, if we can remove the stigma, and if we know how to help those people, honestly, as a city, we'd be 99% of the way there.
So, and you're talking about a broad spectrum of help available. It could be something, anxiety over something, to an instance where you are considering dialing 911.
Right.
So what are some of the options that people in Kansas and beyond might have to reach out for help other than calling the police department?
There really are a lot of resources available. It's not just MHA. I mean, ComCare, a lot of people have probably heard of, is the county provider, and I believe they reach beyond the Sedgwick County as well. But they're a government provider. They actually have a 24-hour crisis assistance. I know that United Way 211, the general information line, has a lot of mental health resources listed there by category. You pick the issue that you're struggling with and hit that number, and they're going to give you a whole menu of options. And of course, there are other providers as well. Prairie View is a private mental health provider. So the opportunities to get help are certainly available. But I think a lot of people don't necessarily know what they do or who specializes in this particular thing. And so gaining familiarity with that is really important. And again, it's frustrating for us in the mental health field because we don't have this problem in the area of physical health. And so why we do in the mental health, it's really a lack of parity, and we really struggle with that in this industry.
Probably the thinking that we would want to relay is no matter where you're at, just reach out to someone.
Absolutely.
Whether it's your county or it's a formal mental health association in your area, reach out to someone until you get that one person that's able to refer you in the right direction.
And a really good example of that, you know, I mentioned suicide earlier. Just 1 year over the year previous, we saw 70% increases in suicide alone. In Wichita, 70% of suicides, or 70% went up. That's a really scary thought, but the reason I mention that here is because when you talk about finding another person, we know that from the moment a person actually decides to take their own life to the moment it actually happens is almost exclusively less than 5 minutes. And that surprises people because they, well, you know, he's been saying that same sentence for months on end. They may have been talking about it, but if you're sitting in your living room alone and you decide I'm going to do it, to the moment you actually do is less than 5 minutes. So anything at all that can be done to expand that amount of time just dramatically decreases the likelihood that someone will actually take that action. So if it means calling your buddy, if it means walking next door to your neighbor, whatever it might mean, anything we can do to expand the amount of time once they've made that decision can really increase the likelihood of saving that life. So telling another person, regardless of what it is you're going through, regardless of who it is, just helps. Yeah.
What do you think is going through the mind of someone that makes that decision in 5 minutes? What would you like to express to them?
You know, what's interesting, and I'm not an expert on suicide, but we actually have a staff member here who is a co-founder of an organization called Stop Suicide ICT. She's kind of our resident expert for things like this. And one of the things she told me that I found really interesting was that suicide really isn't the absence of hope. It's not the absence of control. She said what it really is a situation where people don't believe they have control over anything in their lives except one thing, and that is I have control over my body. I can decide, I get to decide whether I live or whether I don't. And that's a really scary thought, but what that really tells us is there are people out there who simply don't feel they have options. You know, I lost my job, I couldn't stop that from happening. I'm getting evicted. Without a job, I can't stop that from happening. They look at all these aspects of their life and realize they simply don't have control over it, so what's left? So that was a really interesting insight for me. And I think what that really tells to me is people need to be really vigilant and think about the people they know, the people they love, their family, their friends, their coworkers. They need to be aware of some of the signs and symptoms that people use. I saw a list recently, and I don't have it in front of me, but a really interesting scenario about sentences that people use instead of saying, I'm going to kill myself. There are symptoms out there, and I know people a lot of times think, well, if they're talking about it, they're just trying to get attention. That's not true at all. And even if it were true, think about how bad off they must think they are if that's the way they think they have to get control. You know, if they're talking to you, if they're using phrases like there's nothing I can do, I don't even know why I'm alive, or whatever the sentence is, they're probably not kidding. They're probably not just trying to get attention. And like I said, even if they are, they probably still need help. So that's why we really encourage people, be aware of the resources, think about what your friends and family are saying. It's not an attention ploy.
So coming from the real estate world, we've dealt with a number of suicides this past year, so it's interesting for me to hear about the 70% increase. Another thing I hear often from seniors, just a few, but it's very striking, is they'll say, I don't know why I'm still here. And that's very sad, and I think that anyone feeling that way, very much compounded by being isolated and not knowing what all the options are. And so certainly would hope that viewers that might feel like that or know someone that does would reach out.
We work really hard. I mean, I done, before the pandemic, of course, I probably did on average about 24 speaking engagements a year. And in most of them, I probably even never mentioned MHA. I probably never mentioned the Mental Health Association because we're not necessarily trying to raise the image of MHA, but we need to raise the profile of mental health awareness and resources. So I can go talk for an hour to a church or to a nursing home or retirement community where their residents are there, or the staff for that matter. Ultimately, our goal is a rising tide lifts all boats. I don't care if they never come to us. I don't care if they go to ComCare. I don't care if they go to Prairie View. I don't care if they go to whatever county or state provider is available. We just want them to get help. But again, they're not going to do it if they don't know what the resources are. They're not going to do it if they feel ashamed. I saw a study a couple years ago up in Minneapolis where they surveyed people who missed a day of work because of mental health. And a majority, over 50% of those individuals said that they would rather lie to their boss and say they missed a day of work because they were arrested and spent the night in jail than just admit that I missed work because I needed mental health care. That is astounding to me, that we have reached a place in our society where getting arrested and spending the night in jail is somehow better than needing to go see your therapist. It just absolutely knocks my socks off. But what that tells me is people are going into work and they're not going to tell their boss, they're not going to tell HR, they're not going to tell their coworkers, because as soon as they mention a word like depression, their coworkers are going to think, oh my goodness, he's going to come in tomorrow with an AK-47. They're going to look at the Excel shooting, they're going to look at the Las Vegas shooting, they're going to look at the Columbine shooting, and that is now the perception of mental health. And that's exactly why we have to raise that level of education.
And how do you do that? How do you fund the programs that you provide for the public?
Funding is obviously tricky in the nonprofit sector. We are a private nonprofit organization, and certainly a majority of our programs are actually grant funded. So federal grants, state, local, even private grants fund a lot of the programs. A granting organization might have a CEO whose son died of suicide, and so we really want to fund this program. And a lot of times what happens is we'll get those grants, and maybe they're 3-year grants. So we hire a program director, we hire program staff, we begin serving those individuals. And if we're not careful, at the end of 3 years, that grant's not renewed, and now not only do we have to lay off staff, but the people that we were legitimately serving now no longer have anywhere to go. And we're always trying to do that. We're always looking for gaps in services. Organization A does this and B does this, but what about the people in between? And if we can, we put a program up to make sure those people are served. So we're always looking for grants, and actually my predecessor still works here, and she is the director of grants and does an amazing job. Always looking for opportunities to find new grants or renew existing ones, or who else will take this grant over to continue it on. And then obviously a few of our programs are kind of what I call retail programs. The outpatient counseling center, you walk in off the street, you see a therapist, you pay a fee, if you can. If not, we have kind of what I call a scholarship program set up where donors can put money in and actually use that to offset the cost of providing care for those who don't have the resources available. And of course, lastly, there's me. My job is really to find additional sources of revenue. And when I first started, I know we had a lot of households and individuals who were really invested in the mission, and they still are, and just bless them for participating in that way. We have added, really fortunately, in the last 3 years, a lot of corporate support as well. There's a lot of companies in the city who, a company's not an individual, but if a CEO has a wife who suffers from severe depressive disorder, or the CFO has an uncle who died, who drank himself to death, those individuals who make decisions might have a vested interest in what we do. And we've found more and more and more of those over the last 3 years who want to support this cause.
Well, that's tremendous. Well, thank you for the good work you're doing.
My pleasure, absolutely.
And if you have questions about the Mental Health Association and what services are available, how can they reach out to you?
A great resource is our website. We always try to keep that updated. That's just mhask.org. And of course, we're on a lot of social media channels as well, but they can certainly call my office. They can call our main number. They can feel free to call any of our numbers, and the people who get them can liaise with the proper program, the proper individual, the proper resource.
And Eric, you've probably struck a chord with some of our viewers that are watching right now. For those that might want to reach out and help in some way, what suggestions might you have?
Yeah, well, there's, I think, really a lot of options. One of them is I mentioned the Senior Companion Program. I know they're always looking for volunteers, so they can certainly call. As long as they're 55 and older, they can volunteer with that program. Another option, I know we have a lot of, especially older people in the community, who look for ways to get involved in the cause. And so they're doing things like getting brochures and putting them up at maybe literature racks where they live in a community, or approaching their church leaders. We're really making a very strong initiative to get in front of churches right now, because obviously mental health doesn't just affect the community as a whole, it affects individual church members as well. So if we can kind of serve almost as the back office for a pastoral team, and when the level of need has exceeded the pastor's training, we can kind of be that back office. We're trying to get that word in front of pastors. So if people listening maybe have an opportunity to get the ear of a church leader, we'd love for them to mention that idea as well.
Thank you, Eric, for being on Empowering Seniors and for the great information and the tremendous work you're doing for the citizens in the state of Kansas. And thank you for watching Empowering Seniors. If you have questions or suggestions for our show, be sure to reach out to us at empoweringseniors@kpts.org. Until next time, I'm Katherine Ambrose.
This program is made possible by American Senior Benefits Wichita is all about your peace of mind. We specialize in asset protecting, safeguarding your health, planning your estate, and preserving your freedom of choice. We're here to work through all of this with you. American Senior Benefits Wichita proudly supports PBS Kansas. The Candle Club, a place where friends, food, and music come together. Currently, we offer live entertainment every night except Sundays. Enjoy our delicious specialty appetizers and the Candle Club Signature Prime Rib. More about upcoming events at candleclubwichita.com. Home Health and Hospice of Kansas is a locally owned and community-based provider. We offer quality health care to our patients and families, complete with love, warmth, and compassion. We'll take care of all of the details for you. For more information, please visit kansashomehealth.com. Welcome to Cedric Plaza Retirement Community. Our living options are designed to suit your specific needs and activities that you're sure to love. We believe you'll be able to see yourself here, enjoying time with friends and family. For more information, visit cedricplaza.org.